Coronavirus disease 2019, or known as COVID-19, is a respiratory sickness caused by a coronavirus. It is unknown if COVID-19 specific antibodies can give protection against future infection. It is believed that the virus that causes COVID-19 spreads mostly by respiratory droplets created when an infected person coughs, sneezes, or speaks. People infected with COVID-19 have reported a broad variety of symptoms, from minor symptoms to severe sickness. Symptoms may manifest between 2 and 14 days following exposure to the virus. Dengue is caused by one of 4 viruses: dengue virus 1, 2, 3, or 4. Because of this, a person might get infected with the dengue virus numerous times over their lifetime. Dengue viruses are transmitted to humans mostly via the bites of Aedes aegypti mosquitoes. People exhibiting these symptoms may be infected with COVID-19, such as fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. The most common symptom of dengue is fever with any of the following: aches and pains, such as eye pain, typically behind the eyes, muscle, joint, or bone pain, nausea, vomiting, rash. Dengue symptoms normally persist between 2 and 7 days. Contact a medical professional if you develop a fever or exhibit dengue symptoms. Within 24 to 48 hours after the fever subsides, the first symptoms of severe dengue often manifest. If you develop any of the following symptoms, get medical attention immediately: stomach pain, tenderness, vomiting, at least 3 times in 24 hours, bleeding from the nose or gums, blood in vomit or stool, feeling tired, restless, or irritable. The incubation period for COVID-19 is believed to be 14 days, with a median of 4 to 5 days between exposure and start of symptoms. And the incubation period for dengue ranges between 3 to 10 days, typically 5 to 7 days. Risk factors for severe illness with COVID-19 include age greater than 65, underlying conditions like cardiovascular disease, diabetes, chronic respiratory disease, hypertension, prior stroke, liver disease, obesity, chronic lung disease, chronic kidney disease undergoing dialysis, or immunocompromised, for example poorly controlled HIV, undergoing cancer treatment, using corticosteroids, smoking, people who live in a nursing home or long-term care facility. Risk factors for severe dengue include age, infant, second dengue infection. In most dengue endemic countries, children and young adults are at highest risk for a second infection. Patients with chronic medical conditions, including diabetes, asthma, or heart disease.
The best defense to prevent getting COVID-19 is to get vaccinated. In addition, COVID-19 vaccination might offer better protection than getting sick with COVID-19. A booster dose is recommended for people who are vaccinated and whose immune response weakens over time. Another way to prevent the virus from spreading is by avoiding close contact with people with COVID-19 and washing the hands regularly. When soap is not available, use a hand sanitizer with at least 60% alcohol. Avoid touching the face before washing the hands. People with COVID-19 should stay at home and avoid contact with other people to prevent the illness from spreading. Face masks are generally necessary for people who have the illness. Greet people with a friendly gesture instead of shaking hands. The best way to prevent dengue is to prevent bites by infected mosquitoes, particularly if you are living in a tropical area. There currently is no vaccine to prevent the general population from contracting it. To protect yourself, you can use mosquito repellents and use air conditioning, if available indoors. When outdoors, wear long-sleeved shirts and long pants tucked into socks. Make sure window and door screens are secure and free of holes. The most vital thing is, if you have symptoms of dengue, speak to your doctor as soon as possible. To reduce the mosquito population, get rid of places where mosquitoes can breed. These include old tires, cans, or flower pots that collect rain. The most vital thing is, if you have symptoms of dengue, speak to your doctor as soon as possible. To reduce the mosquito population, get rid of places where mosquitoes can breed. These include old tires, cans, or flower pots that collect rain.